yeah, we are live.
What's up, guys? John here.
I'm Sharisse.
We're here with Sharisse's Health and Lifestyle Soapbox live. Here for everybody to join in, be able to, ask some questions, and the topic we're going to go over today. So what are we going to talk about today, Sharisse?
We are going to talk about females and testosterone.
Ooh.
Yeah, because I feel like I've had to go over this quite a bit, and I don't know. There's a lot of different things I want to cover with this topic. I'm going to try to do it in a short time frame here because there's a lot to cover. So let's just start out with females need testosterone, okay? Guys need estrogen, and females need testosterone. So it just matters amount of testosterone that you actually need. So let's give you a couple facts, okay? Let's start with the facts here because I like to give out facts. So let's say a blood test for a female, right? You got your testosterone range, and every blood testing facility is different. They're usually around the same though. But if you LabCorp, Quest, Axiom, whatever it might be, there's all these different places that have different ranges. But generally speaking, you're looking somewhere between 10 and 50. Okay, I'm just gonna make it generalized. Now you want to be at the top end of the scale, right? So you don't need to be at 300, whatever it might be. You don't need to be at 900. You want to be around 50, maybe 60, maybe even 70. That won't kill you, okay? But females need testosterone. Now that's a fact. So there's your blood fact right there. Second fact, okay, is what does testosterone do for a female? Okay, because everybody's under the impression that as soon as you hear testosterone, right? The minute you hear it, it's, that's for a guy. Oh, a guy needs testosterone. Why does a guy need testosterone? Let's all face it. Let's say what it is. Why does a guy need testosterone? For the bedroom, right? Wrong. Okay? It's wrong. It's so wrong. I had to do this live on this, and I feel so strongly about this topic. And I'm going to tell you the situation that I ended up in. These are my trochees right here, by the way. All right, we'll get to that. But, I just think I think people, guys and girls, have a different. They're not 100% sure on what this testosterone deal is for the females, and it's not all about libido, sex drive, erections, in the bedroom. Is it going to help you? Possibly, probably. It's not. But listen, girls. Okay, females out there. Okay. If you take testosterone, and we're talking about minimal dosages that we give here at Titan. Okay. You're not going to want to go and hump a wall after, okay? It doesn't work this way. Yeah. I promise. You're not, maybe. If you're lucky, you might feel that way. But you're not going to feel like that. That's not going to happen, right? So what this is going to come down to is basically mental clarity, motivation, drive, belly fat, back fat. That's a huge one. Metabolism. It's memory. I can go on. Energy. It's if you have low testosterone, you're probably going to be tired. Yep. If you have low testosterone, you might even feel depressed. Yep. If you have low testosterone, you might not feel motivated to get up every single day and go do what you got to do. And you don't have to be getting up to go somewhere to the gym. You don't need to take testosterone to go to the gym. Right. That's your next thing. And that's for you guys out there too. Guys, please do not stop your testosterone regimens because you stop going to the gym, okay? Let me just put that out there because you guys drive me nuts when you say that, okay? So take testosterone because you need to take testosterone because if you're not taking it and you're taking it as a replacement, right. If you're not taking it anymore, you're not replacing it, okay? So it's not going to be there. You're not going to get the benefits of being on testosterone replacement. So there's a right way and a wrong way to do it, but it's not all about the sex drive. Okay. And it's not all about putting on muscle. So people think, and I feel like there's this persona out there, that if you take testosterone, that you're going to be putting on a super crazy amount of muscle, right? You're going to be super jacked, right? Guys, you got to put the work in. Let's start there. Okay. You got to eat the calories. You're going to have to put the work in. You're not going to take a testosterone troche and blow up overnight and be like, raw She-Hulk. No, it doesn't work this way. This is like fantasy land. I want to make sure that I cut out some of these things that are like fantasy land. This is not real. Okay. The myths. The testosterone myths.
The one big myth is females think that if they take testosterone, that they're going to look like a man. Now, all right, there's a little bit of truth to this, I guess, to a certain extent. But this is the cold hard facts. If you're taking testosterone and you're doing it at a minimal dose, right? So you're getting within a normal reference range, a little bit higher. You're not going to have any negative side effects like that. It's when you take a lot of testosterone, okay, and you're taking a massive amount, more than guys take, or the same amount that guys take, then your levels are going to skyrocket and be crazy over level, like where guys are at. And then at that point, you can develop some masculine traits.
You might get a little chin hair, a little mustache.
For the average girl out there, they're not going to have those levels, right? And that's where, you want to make sure that the provider you're going to knows what they're doing, because the problem is this. The transportation rate of some of testosterone treatments can affect you in these different ways. Let me give you an example. So Sharisse takes a troche, right? It's an oral sublingual troche that she's going to take half in the morning and half in the afternoon.
I'll show it to you guys.
It's a very minimal amount.
See? This is exactly what it looks like.
And we can blood test her and then see where her level is going to be at peak.
It's just a troche, okay? And it doesn't taste the best.
If you're getting pellets, most of the time they're putting these pellets in you guys, and females, this is their number one complaint because we get a lot of them. They come here, their levels are through the roof, 300 to 1,000 on some of these girls, and they're wondering why they're getting these negative side effects. Well, my doctor told me this is going to be okay, that put these in me. And at that point, well, you're having these negative side effects. Some of these negative side effects will never go away.
Clitoral enlargement.
All right, deepening the voice. You don't want that raspy voice if you're a girl, because that doesn't sound too good on the phone when you're talking to a guy.
I don't know, some guys like that.
Well, I guess, But this is something that happens a lot to females, and they don't know why. And they don't want this to happen. The regular average female is not going to want their femininity taken away from them.
Yeah, and I'm talking about like the regular. I am talking about the regular average female, right? Yeah. So let's go. I'll tell you what happened to me specifically, so that way you guys can understand where I'm coming from and where I've been and where I'm at now, because it makes a big difference. Exactly. So okay, before I got COVID, right? My hormones were raging, okay? My testosterone, anytime I ever checked it, naturally was in the 70s, 80s, somewhere around there. And that was in the afternoon. Another fact for you, your testosterone's the highest in the morning, and then it depletes throughout the day. Right. So then when you go get blood tested, when you get blood tested in the morning, that is the highest reading that you are going to get.
That's right.
Later in the day, as every hour ticks by on the clock, you are going to go lower and lower and lower and lower and lower. So let's keep that in mind whenever you go get your reading, because it's a big difference if you get it done at 9 a.m. versus 4 p.m. Okay, let me just throw that out there.
100%.
Just another fact. So anyways, I've always been used to, and that's probably why I'm so alpha all the time, rawr all the time, I always had high testosterone. That also led me to PCOS. My PCOS was out of control. I was always in pain. I had high estrogen. It was probably because the testosterone was converting to estrogen, and that was causing, a buildup on my endometriosis, which I've battled for years. So PCOS, endometriosis, basically kicking my butt for years, right? So let's fast forward, COVID hits, boom. All right, takes me out. I get a fun little, septic pneumonia visit to the ICU. That was great. Now, weird thing, okay? Because I know it's out there right now that all these people that got COVID or might have been exposed to COVID or whatever is going on out there, because nobody really, let's be real, nobody really knows, okay? But there's this fertility issue. And now I'm really starting to believe that the fertility issue is a thing, right? So, okay, I get my blood test done after COVID. I want to say probably maybe 2 months after COVID. And I was recuperating, okay? Because I was getting blood tested frequently because my kidney functions were jacked, my liver enzymes were jacked, and my cholesterol was jacked. Everything was messed up, and I have immaculate blood testing. Yep. My liver enzymes are immaculate. Okay, so I get tested. Weird. So I have no production of any hormone, no production of testosterone, no production of progesterone, no production of any estrogen at all. My FSH and LH are totally shut off. Negative, not even reading on the blood test. I'm like, ugh, okay, this has got to come back, right? I'm like, because, I've always bragged about my testosterone. I'm like, hey, I got my own testosterone. I don't have to take testosterone. Other people out there obviously want these levels, and I got them naturally. Keeps me skinny, and, I don't have to go to the gym every day. Ha, ha, ha. Anyways, so, that's the story on me. But, I test again. I'm like, this is crazy. So I tested again a couple months later. Same exact thing. Now I start feeling how all the rest of these girls are feeling. And I am not happy about this, okay? Yes, it definitely did affect my libido a little bit, maybe a little bit. John is very sexy, so, I mean, I don't know. I could have a 0 for testosterone and still want to, get down. But, ultimately, I felt tired, okay? I felt like I am the type of person that's go, 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 okay? Even if I'm sick, like really sick, I still get up and do what I gotta do because nobody's gonna do what I gotta do for me and the business and my baby, whatever it is, okay? So I'm the go, go, go. So to take the go, go, go from me, and my go, go, go is everything, okay? To take that motivational drive and like mental memory, clarity on point, I am always on point. Ask anybody. I am always on point. Art,
always on point.
Always on point. Okay. If you take that from me, it's just like a slap. It really knocks your self-esteem. I mean, I'm sure that females with low testosterone out there have got to be feeling this way, and I'm like, man, this is what they feel like for real. Because obviously, listen, I can empathize with somebody all day, okay, and be like, wow, yeah, obviously, if your hair is falling out, I went through that. Now I know what it really feels like to have hair fall out and to go through that and what it does mentally and emotionally. To go through it is a whole nother story. Then you can really sympathize with that person, and now I'm like, well, now I'm going through this and I don't like it. So I'm like, okay, so I'm like, let me do one more test because this cannot be right, okay? So I do it again, and there you go. So I literally am restarting because I had my hormones dialed in before I got COVID. Dialed in, okay? And I felt good. Everything was dialed in. But now I don't have it dialed in, not all the way, because now my testosterone is not there, So now I got to take the troches. So there's a couple different ways you can take testosterone, all right? You can do it in a troche format, which is the oral format, and we are working on like a rapid dissolve type thing, which would be nice. And don't have to sit in your mouth forever.
Yep.
And I'll get to your stuff in a second. Thank you guys for tuning in. Hi. What's up, peoples? All right. So, anyways, there's a couple ways to do the testosterone, right? I said the troches. There's the cream that you can take, and then obviously there's pellet therapy, which I'm not a big fan of. Everybody has an opinion. If they're entitled to it, that is my opinion. And then there's injectable. Now, we are in 2021, okay? I will say, when we opened this clinic, and even to this day, I'm not the biggest fan of injectable. I really do think you should go through, your troche and cream phase to see if you really, need it, to go to that level, because I feel like that could be a lot.
Absolutely.
The injectable could be a little too much for females, and that's if it takes you too high, that's when you'll start getting the negative side effects.
So a lot of practitioners out there, or some I should say, are starting people off on injectable testosterone, females, right? And at that point, so pharmacies haven't came around to making a form of injectable for females, dosage-wise. So let me give you an example. For a guy, a bottle of testosterone usually comes at 200 milligrams per ml. That means an ml, right, is going to give 200 milligrams dose of testosterone. So for a female, even if you were to prescribe 10 milligrams of injectable testosterone, when they draw it up, it's like barely in there. It's like so
Splash.
little, right? And you think, this isn't going to
splash.
do anything. If you take too much, let's say 20 milligrams, it's going to shoot your levels up too high. The absorbency is faster, right? Transportation rate to get in the body is going to be faster. And at that point, it's going to skyrocket these levels up, testosterone. Now, we also got to worry about other hormones. Let's not just think about testosterone. Cool, we can fix testosterone by injecting testosterone, replacing it. But what we don't talk about is the other hormones that get affected.
The conversion.
Your body's an ecosystem, and if you affect one thing, it's going to affect other things in the body. And that's where we talk about dihydrotestosterone with DHT, aromatization, and estrogen. And that's where some of these other problems will be the culprit, basically.
The hair loss coming into play.
Hair loss with testosterone going up too fast and it being too high of a level, DHT is going to rise.
Yep.
Now, with this, it's kind of like a flip of the coin. If you have family on either side, dad or mom, that had male pattern baldness per se, right? you're going to be possibly affected with this and start losing hair, right? And it'll start coming, and you really won't start noticing it until it starts getting thinner and thinner. And then, what's going on here? And then you're going to be freaking out. Usually females, you know, hair is one big thing for them, right? They don't care about anything else but their hair. So when the hair starts going, they really start freaking out. Us guys, you know, to a certain extent, you know, we can shave our head. We you know, we can do that, you know, and be cool with it. You know, and not have to really worry about it. Like, you know what? As long as I'm performing good, I'm looking good, body's on point, you know, who cares about the hair? But females, it's a whole different ball game. They really do care about these different things. And then the next big thing is after that, these females, they start gaining a lot more weight. And they're like, oh, it's because of testosterone and stuff like that. No, it's probably because your estrogens rose up, right? And at that point, you're starting to gain body weight because estrogen will put weight on you.
And you're not blocking the conversion, obviously. So
you know, it's raised that up. You know, and that's another common thing that I'm seeing out there, and I see in a lot of these different forums and stuff like that. Girls are on injectable testosterone, injectable estrogen. You know, like, what are we talking about here? Like,
so
you know?
Yeah, I mean, so I'm gonna go like, you know, because obviously I'm not on that level, right? I'm just telling you guys what we do here. So as far as our dosages here, right, we're talking about minute dosages, right? Let's say the troche, right? Usually troche, let's say 2 milligram, 3 milligram, 4 milligram, maybe 5 milligrams. You know what I mean? You're not, that is not a lot. And troches are in your system for 4 to 6 hours.
Right.
So it's not like you're having, it's not like the injectable. Yep. Injectable, I mean, unless you're taking propionate, which is in and out of your system in about 2 or 3 days tops.
Very fast acting.
Okay. Cypionate's going to be in your system for 7 to 14 days. Right. You know, and that's a lot longer, harder to control. So, I mean, I'm not opposed to injectable. I don't want to say I'm totally opposed to it. Do I think that you should go through a couple different platforms before you go straight to the injectable? Yep. I do. I definitely think, because listen, my philosophy has always been, you know, the least to get the amount, like the least amount to get the job done, right? You don't want to have to take a bunch of stuff to get the job done. If the least amount can get the job done and you feel good, your numbers are optimized on paper, you feel like $1 million, your husband's happy, everyone's happy, you feel great, you're rocking and rolling, you're getting out of bed, you can do what you got to do. So as I'm saying, the troches is a good one because it's in and out of your system pretty quick. The conversion on that, so ladies out there that you're concerned about your hair loss, I'll be honest with you, we have a lot of patients on the troches and the cream, and I don't get a lot of complaints about hair loss, and it's probably because we're pretty conservative on what we prescribe as far as dosages go with our cream and troche. And if you're lower the dosage that you're giving the patient for testosterone, the less the conversion into DHT. Right. And the DHT is when that gets high, that's when you're having the issues. Yep. So usually people that have their hair that's going to start falling out, you're usually starting to see that with the pellets and the injections, you know. That's why I'm a little hesitant with the injectable, because listen, once you go there, okay, I want to make sure you make this real clear. And some of you guys that might be watching this, you don't care, and I'm okay with that. I'm letting you, as far as me, Sharisse, I would care, okay? I don't want a clitoral enlargement. I do not want any extra hair on my chin. I have to pluck enough on my face as it is, okay? And I don't want a deepening of the voice, you know? I just don't want that stuff.
Oh, let's not talk about possible acne, too.
Acne, you know, but the stuff I'm telling you about isn't going to go away.
Right.
Like, you can't reverse it.
Right.
Like, acne, okay, I'm going to, you know, let me do this, let me change this, let me put some, you know, pads on it here, let me do that, benzo wash, maybe, you know, around a doxycycline, whatever, and then it's gone. Clitoral enlargement, it's not going back down.
Right.
It's not.
Right.
Deepening the voice, it's not going to be fixed. It's
right.
So why go all the way there when you can, if you can get the job done and feel good on something like this, why not? And I'm telling you, because I've been there, I know what it's like to have good testosterone. I used to have good testosterone all the time. Then I had to go through what a lot of you guys are going through and feel all the symptoms of low testosterone. And, you know, not to mention, it does affect how you look.
Yeah.
You know, it really does.
And, you know, how people perceive you, too. Like, you know, I do know women, you know, obviously in the bodybuilding community who went that extra step, and they get it all the time. I see on the Facebook pages, Instagram pages, you know, you look like a man, you know, is that a man? You know, you're transvestite, transgender, whatever they say, you know. And no girl wants to hear that, right? No girl wants to really feel like that.
I don't.
You know, they don't want to be like that. They don't want to go through these different things. And I think the true problem is out there is, you know, a lot of people, right, that are not in the medical field have blind faith in the physicians. And they go to these physicians and they think, all right, this physician's going to help me, and I need to listen to this physician, and he knows what he's talking about, or she knows what she's talking about, and I'm just going to follow the course and do what I'm supposed to. And, you know, that's really how you're supposed to be, right? But there's a lot of physicians out there, providers out there that don't know what they're doing, or they think they know what they're doing, and they're doing this, you know, as far as the pellet route or whatever it is, you know, let's just call it what it is. It's a simple way for a physician to get a patient in and out as far as a number, to maximize on profits and not have to worry about them for 3 months. Instead of have to follow up with them every month like we do. You know, with that, you know, different people need different things, females and males. So dosages can change on a lot of different things, whether it's your testosterone or your estrogen or your progesterone. You know, all these different hormones are there, and they have to be harmonic. They have to be in harmonic balance. Because if not in harmonic balance, things are get thrown off, and that's when you start getting these other issues out there. You know, and we see it day in and day out. We've been doing this for over 9.5 years. All right, so we know what we're doing to a certain extent. We've been right alongside the providers, seeing these different blood tests, dealing with these different patients, males and females, all over the country, right?
Over and over
again,
all day,
that's
every day.
We've gotten to where we are today is because we know what we're doing as far as that with males and females, and we know how to give them results. It's just, you know, at that point, we have a lot of, I don't want to say damage, but damaged people coming here because somebody has messed things up for them, and then we have to try to correct these different things and get things back in harmonic balance and get them back on the right track. It's unfortunate that some females do come to us and they're already past the line. You know, and then we're like, all right, well, how can we help this female as much as possible, right? And that's really where it comes into play, you know. And there's a lot of misconceptions out there, a lot of myths out there about particularly testosterone, and testosterone becoming a big thing out there. I mean, 9.5 years ago when we started, trust me, you started saying testosterone, guys or girls, like, that's for, you know, steroids and that's for bodybuilding.
Oh no, now it's not. Now it's coming along like it's because it's part of preventative medicine.
Right.
I mean, you guys have no idea. You know, it really is part of preventative medicine. And listen. Speaking on terms, this dosage that we're giving you guys, I can assure you that I'm going to put my stamp on it. If it's coming from Titan at our dosages that we prescribe in a troche or a cream, the chances of you, A, losing your hair are minimum. You jacking up and looking like She-Hulk are probably not going to happen.
Not going to happen.
Unless you're doing something on the side that you ain't telling us.
Yep.
Okay? The next thing is, you know, just the misconception of what these things, the negative things that happen with testosterone as far as the hair on your face and, you know, all these other things we've discussed. These dosages that we're giving you guys, I'm telling you guys, listen, I'll be honest. If it was going to happen with this, I wouldn't be taking it.
Of course.
Because I don't want to look like that.
Nope.
I don't. I like to look like this.
Yep.
This is what I want to look like. Yeah, I want to be skinny, you know, but I want to be, you know, I want to look nice. But I just, you know, I'm just like all of you. I want to get up in the morning. I want to be able to feel good. You know, I do want to enjoy sex with my husband. You know, I think everybody does want these things, you know, and the energy and the motivation and the drive, you know.
It's
and
about improving overall quality of life.
For sure.
You know, everyday functions, you know. Listen, some days you're going to have bad days, but majority of your days you want to be good, right? And you want to feel good all the way through, perform your very best. Not have to think about, oh, what was that word I was thinking about? Like, your mental clarity's not there. It's like kind of foggy. Like, it wasn't like this before. Like, you know, a lot of people feel down because of a lot of different situations out there. But, you know, usually, I mean, it has to correlate with hormones. You know, hormones direct everything in the body. You know, they're off, they're deficient. You know, some things are not going to be right on the other end. So that's really where blood testing comes into play, really seeing what's going on inside, and then having a medical provider really be able to adjust things and optimize things like they need to be.
Yeah, you got to be dialed in. Everything's got to be dialed in. I mean, I'll flip this real quick and I'll make a whole nother show on it, I promise. But having high estrogen is no better.
Nope.
And that's what my problem was before I got COVID, was high estrogen levels, and I had to take an estrogen blocker. And a lot of females out there, you guys would be so surprised, a lot of females have high estrogen. So, I mean, that's weight gain. I mean, acting crazy and bipolar.
Can fuel cancer?
Yeah, it definitely can fuel cancer.
Okay.
100%. It leaves this, like this nasty, like layer of water over your whole body. I don't care if you drink like 8 of these a day, right? You're still like holding this weird, like, water all over you.
It's like a little film.
It is like a film,
Yeah.
you know, especially in the midsection. And my midsection, that's been my hardest place to really dial in, you know, my whole life. But, you know, that's another issue, is that specifically.
Right.
You know, I'll say about progesterone. And this is for guys too, same thing. Progesterone, it helps your hair, skin, and nails. But it also helps you sleep at night.
Sleep, anxiety.
It helps with anxiety.
Yeah.
You know, these are huge things that people do not realize. Look, it's here.
Oh, Tina, we
Hi,
love
Tina.
you.
You know, it's important to have all of these dialed in, and we always go back to the piano. I forget who said that. Hulk over here.
Yep.
You know, that it's got to be dialed in. It's harmonic balance.
That's
Everything
right.
is a harmonic balance. You cannot just be one way or the other.
Yep.
And listen, there's people out there, they're going to go do what they want to do.
Right.
They're going to go look how they want to look.
Yep.
Okay. But I wanted to make sure I got on this live today specifically because I'll be honest with you. If you watch this, I'm sure you'll know who it is. I had one of my girlfriends, because she's telling me she can't lose weight. She's like, I feel so tired. I have to take my Adderall, blah, 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 blah. And I'm like, okay. So we do the blood testing. She doesn't come back deficient, but she came back like, you know, the low mid range. I think it was like, if I had to say a number, I would say like 11, right? And I told you, we want to be at the higher end, like 40, 50, whatever it is. And I'm like telling her, because we gave her the prescription fat burners. That's what she wanted to do. And she stopped taking the Adderall. And, you know, she's still not feeling 100%. Okay, you're complaining to me, but I'm telling you that what you need to do is you probably need a low dose testosterone, even if it's a minute dose, like 2 or 3 milligrams. It's not a lot. I mean, in the bigger scheme of things, guys take anywhere from like 100 to 300 milligrams a week. We're telling you to take 2 or 3 milligrams a day.
Right.
Okay? Whatever that is. I can't add.
And remember, males and females have the exact same hormones in the body, just at different levels.
Yeah.
Right? And that's just what it is, and that's what makes us who we are. You know, the other thing I just want to throw in there is like thyroid. Guys, your thyroid is very serious. And a lot of providers out there just throwing people on thyroid medications left and right.
Yeah.
That can affect hair, weight, mood, everything too. So that's not something just to play with lightly. Okay? So if you are getting some sort of treatment and stuff like that, make sure that is necessary, because you do not want to mess with the thyroid either.
Yeah, that's a big one.
That's a
And
whole
then
different. That's a whole other life.
Yeah, once you start messing with the thyroid, sometimes there's no going back. But
some people really do need it, hypo and hyper. But you know, at that point, you know, I've seen a lot of normal people get thrown on thyroid medications to lose weight. That's not a good thing, guys. So
you guys, a lot of you guys out there too, like, and I'm not just talking about like whatever. If let's say you're a beauty pageant queen, or let's just say you're a model or a bikini girl or whatever it is that you're trying to shred up, right? Everybody, I need you to remember, and I tell everybody this all the time, okay? That there is life after whatever it is you're doing.
right.
Okay? So you got it. I know you want that short-term result, okay? You're looking for that short-term result, and you will do whatever it takes to get that short-term result. Maybe it's just for a photo shoot.
Right.
You know? I felt the same way when I did the fashion show a couple weeks ago. I was like, oh my God, what am I going to do? I need this short-term result. Same thing. But you got to remember, there's life after the short-term result, and you got to make sure you don't do any serious or permanent damage to your body in the short-term result phase, so that it affects you long-term. You don't want to do that. I mean, it's some things are like I was telling you. I know some females will come to Titan, and they'll be like, I want to get injectable testosterone. I'll be honest with you. Up until about maybe a year ago, we did not even prescribe it. You know why we didn't prescribe it? Because I wanted to make sure, and our medical directors had to make sure, that these females were not going to get the negative side effects.
Right.
Because you can't go back. Like, once your clitoral enlargement happens, I cannot fix it.
Right.
And I don't want that. I would rather taper up than taper down.
That's correct.
Right? You want to taper up than have to be all the way up here and then taper down, because it's a lot harder to do it that way.
Absolutely.
Okay? You can always add in, but have to take out is a little harder to do.
Even when DHT comes up, when DHT goes up, it's not something that just goes down overnight.
It's not.
So you're going to go through a shedding period with your hair.
Shedding.
And you're not going to like that. I'm telling you,
not gonna be
females out
happy.
there, if you went through it, you know what it is. And you females that haven't, I'm telling you, you do not want to go through that, because it's not a pretty sight for females to start losing their hair like that.
I know. I've been through
in
it.
clumps.
I've been
and
through
sending
it.
pictures in clumps of their hair.
I've been
in
through
their
it.
hands. I'm like, what am I going to do? Do I have to start wearing wigs for the rest of my life?
Yeah.
Like, I'm telling you, I'm seeing it. You don't want it. And if you do want it, you're going after some other goal, then you make sure that you're going to have to live with that for the rest of your life, because that's something that doesn't come back easy. I'm telling you guys. even with all the different things out there. We have great hair therapy treatments that help tremendously.
Yeah.
So, that might be an option down the road to help possibly, and there's other things out there like hair grafts and stuff like that, which I'm telling you are not a good viable option either. All right. I know a lot of people that went through them. So, and it's not been the best result every time for sure. 100%.
Well, I mean, like I said, I wanted to hop on this and just kind of clarify some things because some of you guys are driving me crazy out there, okay? Because you guys are like super twisted on what exactly is going on here. I need to just lay out some of the facts. And then I was going to share that I'm taking testosterone troches too.
That's right.
I am. And look at me. I mean,
it's very normal.
It is. I mean, listen, I would say 9 out of 10 people that we test for testosterone deficiency come back with a low testosterone.
Yep.
And that's for guys and for girls.
Yep.
So if you are feeling tired or you're not feeling motivated or you feel foggy or you just don't feel the same. Maybe you can't even put it like a finger on it, but you're like, I just don't feel like I used to feel.
Right.
You know what I mean? Like
what's going on with me? Like what's going on?
It's not gonna kill you to get your hormones checked. That's first. Secondly, you can make an educated decision on what's going on after you see what the hormones look like. And then third of all, if you do need testosterone, I wanted to make sure I X out some of these things so that you understood that at a very minimal dosage, you can get the results you're looking for and feel better and look better.
Yep.
You know what I mean? Without some of these crazy things. I'm telling you guys, you really got to take a lot of testosterone to look like jacked.
Yeah.
You know?
I'm telling you guys, you don't want the negative side effects that come with it. For sure. So, that's going to end today's...
Yeah, bye! Gotta go!
Sharisse's Health and Lifestyle Soapbox will be here every week for you guys. She's going to bring you guys great topics, you females in particular. I want to give you guys a lot of love out there and knowledge. With my Titan Talk, I go over different things, but at that point, hearing it from my wife, who's next to me all the time, I'd like her to chime in and talk to you guys about some of these different topics because I can give you guys a great guy perspective. I can help out with females to a certain extent, but there's nothing like hearing it from a female. Right? Because, internally she's different than I am. So, she's went some different things that I'm never going to go through, thank God. And, I bless her for that. So, this has been another great week for Sharisse's Health and Lifestyle Soapbox. We'll see you guys next Wednesday at 1 p.m. Hope you guys have a great Memorial Day weekend.
Yeah, have fun.
All right? Enjoy time with your family, your loved ones, or even by yourself. Hey, who cares? Yeah. And just make sure you enjoy yourself. You're living your best life out there. So we appreciate all you guys. We'll see you guys next week.
Bye, guys.
On Sharisse's Health and Lifestyle Soapbox.